we do things as labor. We don't do it under the stance of just CWA or IBW. We do it as activists in our community that are trying to not just uplift ourselves, we're trying to uplift people living and working in our communities. My name is Erika White. I'm the Vice President of CWA Local 4319. I work for AT&T. I've been employed there for 16 years. Started out entry level as an operator. Those are the bigger units that we hold are AT&T, the Toledo County Library, University of Toledo, and then Lima, Allen County Children's Services, Job and Family Services, and Child Support. I love the way the CWA, we got our triangle, the way they try to integrate all parts of organizing, mobilizing the political side of the triangle, which we call is how we build our local. It's very grassroots, which means that the locals hold a lot of power. We're able to, when I say power, we're allowed to give that feedback and really represent our members. That's one of my biggest goals, is to educate the membership and get them more involved in the political process and the labor process. I'm looking forward to the Free Choice Act that really needs to be implemented. A lot of changes with National Labor Relations Board. It's so sad to go into a contract negotiation and you really don't have a National Labor Relations Board that will back you or hold the employer to the guidelines which they should be held to. The most important, I would have to say, is job security and health care. I look at my father-in-law was the sole supporter of the family. My husband there's 3 brothers, it's him and 2 other brothers. He supported his whole family for many years. Bearing steel clothes, sole supporter. He lost his job. Had been there 29 and a half years and hasn't been able to find a job. It brings tears to mind. It's heart-wrenching, and they don't ask, can they have $20 to go to the store? And his mama's a diabetic, and we've had to try to help them. How much is your medication? $100. I didn't want to ask. Wow, that's not only hurtful for them to have to come to their children and ask, can I get money for my medication? But it's hurtful for us to see them go without things they need for an illness because they can't afford health care. There's nothing there. They've been told they can't get Medicare because they're not old enough, and they don't have any children. It gets to being very sad. His voting record has been very, very harsh toward working class America. And I look at his fact, he wants to stay in Iraq for another 100 years. Well, I kind of have a problem with that because we're going to start out of people, which means me personally, I worry about my son being drafted. I worry about my children and grandchildren going into starting their lives out with more debt than they'll ever be able to pay in their lifetime. And I look at the fact that this probably seems really silly, but to me it's a real concern. You have a man that's in his 70s that, is he going to have to really live or deal with any of the ramifications of what he does when he's in office? I don't think so. I'm ready for change. I'm excited about it, and anybody can tell to go out and vote. Definitely. It's going to, if we can do this as labor, I think we're going to really change the forefront.